Good afternoon. President Farvardin, boards of trustees, faculty, staff, students, and honored guests. It is my distinct pleasure to welcome you to the 2018 Innovation Expo at Stevens Institute of Technology. We hope that you have enjoyed the spectacular views of New York City while on campus, that you were able to visit each of the buildings displaying hundreds of students' senior projects and PhD and faculty demonstrations. And at this point, I would like to introduce a man who epitomizes the concept of entrepreneurship, Mr. Thomas Scholl. Tom Scholl, in addition to being a member of the Board of Trustees of Stevens and a benefactor of the Institute, is a successful entrepreneur, venture capitalist, and technology innovator. As a person who has been directly involved with 40 startups, Tom takes a very personal interest in the achievement of Stevens entrepreneurs and inventors. In 2012, he established the Thomas H. Scholl Lecture Series by visiting entrepreneurs, which features notable entrepreneurs and executives whose successful businesses has helped change the world for the better. Scholl received a Bachelor's of Art in Philosophy and Literature and an honorary Doctor of Letters from Purdue University. He holds patents relating to software, the internet, and digital telephone systems. He serves as chairman of the Board of Visitors for the University of Maryland's James Clark School of Engineering. And of course, he is a member of Stevens Board of Trustees. And he was awarded the Venture Capital Friend of Entrepreneurs, awarded by Washington Business Journal based on nomination from other entrepreneurs. Tom, would you please come up for a second? Tom will do us the honor today. Tom will do us the honor today of introducing the 2018 Innovation Expo Thomas H. Scholl Lecturer. Tom?
Thank you very much.
Thank you.
Thank you, Mo. I'd like to introduce John. John M. Nehra graduated from the University of Michigan with a BA in 1970. Upon graduating, he joined Doyle, O'Connor and Company, a leading nationwide NASDAQ trading firm based in Chicago, as an associate in their venture group. In 1971, John built for Doyle a small research and sales department following small to medium-sized publicly traded growth stocks, complementing the firm's historic trading capabilities. With the passing of Bob Doyle in 1975, the firm never fully realized its full potential. And in 1975, Alex Brown & Sons hired John to build a corporate strategy around healthcare with an expanded approach to investment banking. For decades, Alex Brown became the preeminent national firm in healthcare research, trading, and banking. Alex Brown adopted this strategic template in software, transportation, consumer, and financial services. In 1981, John became a partner of the firm, and John also worked with Alex Brown's partners with an entry into venture capital, merchant banking, and capital markets. John worked and managed healthcare-related research and investment banking, ultimately managing the capital markets desk. In 1989 until his retirement in August 2014, John was affiliated with New Enterprise Associates, known as NEA, a leading venture capital firm, including from 1993 until his retirement as general partner of several of its affiliated venture capital limited partnerships. John also served as managing general partner of Catalyst Ventures, a venture capital firm, from 1989 to 2013. John served on numerous boards of NEA's portfolio companies in healthcare and technology until his retirement. John remains a retired special partner of NEA. Since 1999, John has served on the board of DaVita, which has a ticker symbol of DVA. He advises and is on the board of several private companies. He has been active with the Baltimore School for the Arts and various charities. John is married and has 2 daughters. Now I would like to make John a couple of personal comments myself. First of all, for those of you who know me and have seen these lectures in the past, we've tried to have really great people come to Stevens to be introduced to you. And I'm pleased today to have what I consider to be one of the best of the best. You know, you're going to find that out for yourselves. It's a real treat to talk to somebody like John that has built with other entrepreneurs billion-dollar companies, not just once, but many times. How many people in this room have ever dealt with a venture capitalist? Okay. Then you know something about their characteristics. I want to tell you about when I first met John. John offered to put some money into my first company, Telegy Networks. But I didn't get around to actually closing anything for about 9 months after I talked to John. And just before we were ready to close, I had a board meeting, and my attorney asked me if John was still going to put money into the company. And I said, well, I think so. And my attorney said, well, do you have it in writing? I said, well, no, I don't have it in writing. And he said, Tom, you've made a gigantic mistake. You cannot trust venture capitalists. My prediction is this whole thing is going to go bust. So needless to say, I ran from the board meeting and I immediately called John. And I said, you know, are you still interested in putting money into Telegy? And in disbelief, John said to me, yes, of course, Tom. I gave you my word. And that's the kind of guy John is. And my only advice to him today is don't be too humble, John. You're a tremendous partner. I've witnessed it myself. I've enjoyed your company so much. I've learned so much from you. And I'm so pleased that Stevens is going to get to hear what you have to say today. John?
Thanks, Tom. It's a pleasure to be here today to talk about one of my favorite subjects, venture capital. And as Tom alluded to, I did invest in Telegy, but what Tom didn't tell you is Tom loved me for, how many years was Telegy, Tom? About 10 years? So for 10 years, Tom said, you know, you're the best guy, the greatest guy. I don't know what I'd do without you. And I kept writing checks, check after check after check. Company gets sold for, at the end of the day, about $1.4 billion. And Tom says, look what I created. So the CEOs take all the credit when the wins come in. And they forget about the venture capitalists that kept writing the checks so that he could have a good time. But that is the life of a venture capitalist. Some of them have terrible reputations, and I did work hard at being differentiated. When you're working from Baltimore, you have to be differentiated as a venture capitalist, always competing with the folks in Menlo Park and Minneapolis. But I always remind my partners that we actually had more investments in Menlo Park, the Bay Area, and in Minneapolis, the two major centers for medical device companies, than the local venture capitalists had. We sort of spoke to the fact that we could really travel well and bring the partnership and the partnership's interest coinciding with the entrepreneur. So Tom asked me to spend a few minutes today talking about what's involved in creating a new enterprise and what are some of the secret ingredients that I deployed being a venture capitalist. Tom was kind enough to review my history. Some of you may or may not know NEA, but NEA is the largest early stage venture capital firm in the country. Currently has over 500 active portfolio companies and true innovators in the fields of technology and healthcare. The investment approach that we deployed at NEA really, you could summarize into three sectors. Seed venture capital, which is the area in which I spent most of my career in, funding attractive companies that expanded just beyond the seed level, had proof of principle, and then I'll call the easy investment, doing a mezzanine private financing prior to a company getting acquired or prior to a company going public. How do we establish credentials as venture capitalists? I often told my partners, particularly the young partners that came to the firm, is you have to talk the language. You have to know the technology. You have to understand the industry that you're working in. You have to be able to relate to CEOs and entrepreneurs and be very inquisitive, be a good listener. And probably being a good listener is the hardest technique for an investor to acquire. And then asking pertinent questions, of that CEO or entrepreneur. Who does he admire? Who does he feel is innovating in the same space that he's involved in? I often got many of my leads for investments from networking with these individuals. And the other thing is chasing down every lead. I had a partner, Frank Bonsall at NEA, who actually helped attract me to Baltimore. And Frank at the time was working at Alex Brown. And Frank never turned down a phone call. He never turned down a meeting. He saw the good, the bad, and the ugly, and he would drag me into every meeting. And sometimes I would just shake my head saying, why am I wasting an hour or 2 hours of my time? This thing's a loser. And I'd often express my frustration to Frank, but at the end of the day, it really taught me to differentiate what is a good company, what's a bad company, what's a good investment, what's a bad investment, who's a good CEO and not a good CEO, who can lead a company and not lead, and who am I prepared to write a check to. Obviously, Tom hit all the boxes when I first met him. So the key to any new enterprise is teaming up with the right entrepreneur, innovator, and working with these individuals. We would sit down with a blank piece of paper and say, where is the greatest need in the marketplace? Who needs an innovation to solve a big problem, and who's willing to pay for that? It sounds simple, but very few companies and very few venture firms execute on that principle. So we would spend months and even a year looking at market alternatives. And in this case, in the healthcare field, we would spend the time with physicians in particular specialties, learning what their biggest problem was, and can we as entrepreneurs, as venture capitalists, as engineers solve their biggest problems by innovation. Most companies, most technologies, most universities develop technology and then chase the opportunity. We did it in reverse. And I think we were successful and had a higher percentage rate of success doing it that way. And what did we demand at the outset? We demanded significant ownership. I'd often tell my entrepreneurs, your idea is worthless because it hasn't been developed, and I'm bringing capital to the party. And for that capital, I did want large ownership stake in the business. And often the CEO would go, oh my God, I'm going to own less than 50% of the company. I won't have control. And I said, look, we're partners together. We're going to live or die by our success or failure. And I really tried to preach with the individual that to trust me 100%. I would be fair to him as long as he was transparent with me and shared the good and the bad with regard to our success. The other thing I preached to our CEOs was to have a long-term time horizon. Everyone thinks it's a quick exit in venture capital, but in fact, it's a very long-term time horizon, sometimes exceeding 10 years. So one of the advantages of being with NEA, a very large capital base, is that we could fund these companies for extended periods of time. We talked about selecting the right founder. It was also important to build the right board. I drew upon my multi-decades of relationships with executives throughout the healthcare industry to attract them to the boards and not only be a mentor to the CEO, but also to advise on the right people to hire. We would, almost every hire that we made, saw and interviewed with the board if they were a finalist. Also important to size the investment. We would often look at what are our near-term goals that we need to achieve and to right size our initial investment, which may be $2, $5, $10 million. And once we hit those objectives, then we could go through an expansion financing of up to $20 million. And then commercialization required us to write another check of $50 to $100 million. So we often did this, and I'll draw upon some examples later on. So it's key to create the right milestones and create the right level of financing. So often companies grow beyond their need, beyond their capital needs. And they have to downsize and do a down round of financing. And it's like, I would often preach to them, never do a down round. That's the worst thing that you can do as an entrepreneur. Although at times we had to bite the bullet and do it, we really worked to try to avoid that. Some of the other aspects that we played around with, one of the keys there is developing the role of the founder. More often than not, I would say to the founder, every year we're going to sit down and talk about your role, what you're contributing to the company. And there may come a day, may come a time when your role has to change. You may not be the CEO once we reach a commercial level of development of this company. And I will work with you to redefine your role. And this was a critical component to our reputation, is treating the executive team fairly, treating each member of the team in a very fair way so that their enthusiasm would continue to remain with the company and add value to the enterprise. And we also define the role of the founder. Are we NEA an active investor or a passive investor? More often than not, we were a very active investor involved in all the major strategic decisions of the company. We did not run the company. We never ran a single company. And one of the things Frank Bonsall taught me was never get involved in the day-to-day affairs of the business. You're there to be a strategic advisor, not to be someone who second guesses the CEO. The moment you begin to second guess the CEO, that CEO should be removed, or you should. What are some of the vehicles that we employed? The most successful vehicle that we utilized at NEA was the incubator. And the incubator was created initially by us in 1995. We hired an engineer out of Pfizer, and he was recommended to me by one of my Alex Brown CEOs that I had met in the early 1970s. His company was acquired by Pfizer, and he called me up and said, there's this young engineer who's very frustrated at Pfizer. His ideas are not being listened to. His inventions are not being commercialized. He really wants a new opportunity. And we interviewed him, myself and one other partner, and I think within a matter of a couple months we hired him. We gave him several $1 million, and we said, let's start companies together. And as you'll see throughout the presentation, he and I created 7 companies and financed 7 of his companies together, 2 of which sold for close to one over $1 billion, one close to $1 billion. And that venture was called Exploramed. The Foundry was another incubator of ours, which we created from a former executive of Abbott Labs, who I met in the early 1980s on a road show for Home Healthcare of America, a company I was taking public in Chicago. And we struck up a relationship. He ran two of NEA's startup companies in interventional cardiology, became an executive of Medtronic, and when he retired, he said, why don't we work together to do an incubator? And we did that, and one of the most significant companies in interventional cardiology for the treatment of heart valve disease, he and I founded and ultimately sold to Abbott Laboratories for over $400 million. Protostar, another incubator in Minneapolis, in this case, a retired executive of Boston Scientific, Dale Spencer, had sold his company to Boston for almost $1 billion. He grew it to be the largest interventional cardiology company. He retired from Boston and said, why don't we work together to start an incubator? And we recruited our first engineer from Medtronic, who was an expert in heart failure. And I'll come back to that. In the case of Denali, it was two engineers out of Boston Scientific that Dale Spencer had introduced to me. And these two engineers founded the incubator, Denali, which they held when they joined us, I think over 150 patents at Boston Scientific. They were the most prolific engineers at Boston Scientific, and we were just fortunate to get to work with them to do startups. I'll come back to meeting a venture capital firm. So what's our roadmap? We really, when we define opportunities, we try to define those market segments that offer the greatest value to the patient, where are the greatest needs, and I mentioned, will people pay for these ideas? We discovered these sectors, cardiology, orthopedics, ophthalmology, urology, cancer, aesthetics, women's health. People were willing to pay for the technology. By people, I mean insurers. And if the insurer wasn't willing to cover it, individuals were willing, particularly in the case of aesthetics and women's health, willing to pay out of their pocket for new technology to solve problems. And and further, we discovered if you develop proprietary technology in these sectors, you could build high barriers to entry. And what do we mean by that? We've invested in some cases $50, $100, $150, $200 million to get a product through the FDA. That's a significant barrier to entry in addition to the intellectual property that we developed. So we had multi-year advantage and capital advantage creating businesses in these sectors. I mentioned teaming up with individuals. We had near exclusive relationships with these individuals. Bob Croce was the group chairman at Johnson & Johnson for the medical devices group of Johnson & Johnson. Bob joined us as a venture partner, and he and I think, shared as many as 6 board seats together at NEA. Bob Anderson was the founder of a company called Valley Labs, sold to Pfizer. I mentioned that earlier. Interesting point, every investment banking firm came to Bob Anderson and said, you got $30 million in your sale to Pfizer. You need to sell that. You're too concentrated in Pfizer stock. Bob said, no, I sort of like this Pfizer company. Bob basically held on to every share that he owned of Pfizer. He became the largest individual shareholder of Pfizer, and he became the largest employee shareholder of Pfizer, individual shareholder, by hanging on to his stock over a 30-year period. And Bob became a very valued executive. And to this day, Bob is a very close, over 40 years we've had a relationship together. Bob introduced me to Josh Mackauer, who founded Exploramed, and he and I have sat on a number of boards together. Jay Graff was the vice chairman of Guidant. Guidant was a $29 billion valued company, and its sale to Boston Scientific and Abbott Labs. Jay became a very close personal friend. His experience in the interventional cardiology and pacemaker area became very invaluable to me, and Jay served on a number of boards and was a great mentor to a number of CEOs that we have. Scott Gottlieb, you might recognize that name. He's our current FDA commissioner. Scott was an advisor to NEA for over 10 years in regulatory issues. He served at CMS and FDA before joining NEA. And unfortunately, we had to lose Scott to the current administration. But he's revolutionizing what's going on at the FDA. His commitment, get drugs out, get innovative products out of the regulatory cycles that they've been going through. So Scott's done an unbelievable job of accelerating the regulatory approval path without sacrificing safety to patients. And he is very rigorous from a scientific point of view and a clinician himself. Same with Steve Osterly. Steve was the Chief Technology Officer at Medtronic, and he became a full-time venture partner at NEA. Michael Demain, Chief Operating Officer at Medtronic, served on several incubator boards with me when he retired from Medtronic, and ultimately joined a company, Nehra, which I will tell you about in a little bit. I mentioned Dale Spencer, and I mentioned Alan Will earlier. So it's important for any entrepreneur to surround himself with successful people. And why is that? Successful people, from my experience, will not hesitate to tell you the truth. They have no agenda. All they will give you, more often than not, because they no longer have issues with themselves. They have 100% confidence in their financial well-being and their personal life, and they're willing to take time out of their day and spend it with raw startups, and spend it with people that are willing to take risks and be risk takers, and they're excited by that. And they'll call bullshit on you when it needs to be called, and they'll help you when you call them up and say, I need help. I need advice here on helping the CEO get over this problem. I need help on interviewing for a new engineer or a new CFO. So it's just terrific to have those people at your disposal. And then these companies, we develop significant corporate relationships with. They often co-invested with us. And these are multi-billion-dollar, I know there are maybe not a lot of healthcare people here, but they're multi-billion-dollar companies. So it's important when doing a startup, you want successful people, successful companies helping you to succeed. And this was one of the ingredients that we deployed at NEA. I'm going to take a moment and go through some of the ventures that we started up and give you a sense of why we chose these companies. CVRX, I mentioned earlier, we hired an engineer who was responsible for heart failure at Medtronic. Even though Medtronic hadn't entered the business, he was able to do some research and discover if you stimulated a nerve in the carotid artery, which runs along your neck, if you put a little tiny electrode on that bed, you can raise and lower the blood pressure, change kidney function of the patient. And because the patient couldn't lower their blood pressure through medication, they were able to do it using an electronic implantable device. We discovered the same technology can be used to treat patients with untreatable heart failure. So we've done extensive clinical trials in the US in both applications. We currently sell the product in Europe, and we hope to get FDA approval in the next 12 to 24 months. Very exciting technology. It's this company, if you look at the concept, it took us about 5 years to evolve it to be proven in humans, but the company is actually over 15 years old. And we're still funding it, and Johnson & Johnson is our major shareholder. I mentioned earlier about solving unmet needs. There's a problem that people had called chronic sinusitis, which develops usually a seasonal allergies aggravate it, and people have runny noses, they're stuffed up, they've got headaches, and heretofore you basically took a Roto-Rooter as a surgeon and you cleaned out the people's structural sinuses. It was very bloody, very painful, and the outcomes weren't very good. Josh Mackauer and a team of engineers took interventional cardiology tools and applied it to the sinuses. So they identified a big problem, an unmet need. Patients weren't happy. The recovery time was long, and they could do this procedure, and immediately the patient was totally relieved. This company was about a 5-year experience for us and sold it to Ethicon for close to $800 million. Claire Vista, individuals, particularly elderly individuals who have cataract surgery, end up with an artificial lens. 40% of the time, these patients aren't happy with the outcome of the surgery. The vision that they have isn't that good. So post-operatively, they do laser procedures to try to further improve the vision, and usually it doesn't satisfy the needs of the patient. This company, which was the technology was developed by a physician in Colorado, we were able to switch out the optics of the implanted lens, just not the base of the lens, but just the optics, post-operatively, to enhance the vision for the patient. We've done hundreds of patients. The outcomes have been phenomenal, and Alcon late last year acquired the company and the technology from, and I think NEA was a 60% shareholder at the end of the day. And the individual who was running this company, we attracted from Guidant. I mentioned that company earlier, and he was an experienced interventional cardiologist, and within 6 months learned everything about ophthalmology. Ivanus, another creation out of an incubator. Denali, this was the creation of these two engineers out of SciMed. We said to them, let's look at the field of glaucoma and all the solutions that are currently being used. Are they satisfactory? And they concluded they were not. And so these individuals took their stent know-how of nitinol material and applied it to the Schlemm's canal of the eye and reopened the canals of the eye to lower the intraoperative pressure of the eye. And now it's performing 20 to 25% better than the gold standard today. It's in clinical trials, and we hope to get FDA approval in the next 12 to 18 months. So again, we were able to identify a big unmet need, glaucoma, and hopefully this company will be worth a significant amount of money, either going public or being acquired. Cartiva, in this case, we had a serial entrepreneur. This individual, Tim Patrick, ran a oncology device company for me when I was running an incubator fund at NEA, and was successfully sold. I asked him to start up another business. He went out and he acquired a technology of an artificial cartilage to be used for arthritic thumbs and arthritic toes. It sounds mundane, but a lot of individuals over 40 suffer significant arthritis in their large digits. And the usual outcome is massive surgery where you lose the function of the toe or the function of the thumb, or they fuse the joint together. For the first time, you can use an implant to solve the problem. And after extensive clinical trials, the product was released in 2016. Revenues last year are $24 million. 90% plus profit margins, and looking at 40 million this year. And a lot of orthopedic companies are knocking on their door to buy the business today. I mentioned Michael Demain earlier. Michael identified a company that had been mismanaged and had an angry board, and he looked at evaluating the company and joining it as a CEO. Michael sat on a number of our incubator boards together. Michael asked us to assess the situation, and we gave him our thoughts and opinion, and later on gave him $40 million of our capital, and we were extraordinarily successful as investors. Michael completed an IPO in 2014, and today the market cap is well over $2 billion and revenues of $300 million, and looking at $400 million north of $400 million this year. They are the leading company in innovating technology for eliminating pain, lower back pain, and they're in evaluation for pain in the cervical collar area and upper back pain as well. Reduction in opioid use, and totally reliant upon electronic technology to reduce pain. It's a very timely technology, both here and overseas. Rotation Medical, in this case, our two engineers from SciMed, we did a grid. We said, where in the orthopedic field is capital not going to, and where is the greatest need? So we created a matrix and basically figured out the shoulder space in orthopedics was the most underinvested area in orthopedics. All the money is going into hips, all the money is going into knees, all the money is going into extremities, but not going into the shoulder. So we developed a technology to regrow tendon using a collagen-based material. We evaluated 13 materials and came up with a proprietary material, and for the first time ever, grew tendon, complete tendon in the shoulder, and the implant dissolved over a period of 90 days. So instead of suffering open surgery, you can receive this technology on a minimally invasive basis. Smith & Nephew featured this product in their recent earnings call with analysts and acquired this company late December for over $200 million. Another great success for one of our incubators. NeoTract, another example where we looked at the medical device field of urology. We said, where's the biggest unmet need? Men have enlarged prostates. They get up in the middle of the night 2, 3, 4, 5, 6 times or more to basically empty their bladder. Tremendous urge. Josh Mackauer at Exploramed discovered that if you could cinch the prostate open in basically an office procedure using local anesthetic, you would significantly reduce the pain, the blood loss, the need to wear diapers postoperatively, and it has become the hottest item in urology today. The company sold for over $1 billion to Teleflex, and the only negative to this story, it took us 12 years to realize the commercial success of this company, and I think they invested over $300 million to get to the end game. But it was an extraordinary success. We went through 2 CEOs that didn't work, finally found the right individual who spent the last 6 years building the business and the opportunity. So it's just been an extraordinary outcome for proving the incubator model and proving NEA's ability to stick with a good opportunity. And you could ask yourselves, why did you, 12 years, isn't that crazy? And even with CVRX, 15 years. What drives us to keep funding these things is the clinical data. The clinical data kept coming out. It's unbelievable. It's fantastic. And at the end of the day, clinical data drives value. And the final company is Willow. This is women who are pregnant and deliver a child need to, more often than not, breastfeed. Breastfeeding and collecting milk is one of the most difficult things for a woman who has just delivered. So Willow, and you can look at their website, developed through ExploreMed an electronic pumping mechanism that a woman would wear on her breasts. It has disposable containers that collect the milk during the day so she can go about her daily work while collecting the milk, her daily tasks at hand. And the company showed its product at a meeting, and they received, I think, 14,000 inquiries on the part of participants at this meeting. So the product is just beginning to be commercialized in the United States. We'll come to Q&A, but I just wanted to summarize here some of the key points, of innovation. Where is the largest unmet need? Find mentors that will work with you. Be a first mover or a fast follower. You've got to have capital. You can't build a business without capital. Having good capital partners you can trust, is important. It's not about the ownership, it's about the end game. Can I hit the goals with the capital I need? And are funds looking for the opportunity that you want to develop? It's important. You don't want to develop something that nobody has an interest in funding. So it's always good to say, I can point to 3 or 4 other examples of people that have succeeded in this business with a startup in the related, it may not be my exact space, but I know venture capital has an interest in this sector. And that's the last point there, pointing to success stories. So I'll turn it over to the most important thing, the Q&A side.
Talk a little bit about the funding mechanisms that you use with other syndicates of organizations in terms of the scale, or was it always single investments from NEA?
Well, not to tell tales, most of our incubator funding was solely from NEA. And the reason being, in the first case of ExploreMed, we invited in a small founder, another venture capital firm. We found that they weren't willing to participate in every follow-on round of funding. They were willing to seed it, but when it came time for their pro rata share of funding, they would go, we got capital constraints, we have issues, we're not going to participate to the extent you're expecting us to participate. So I got very frustrated with that. And I said, well, the next time we do an incubator, I'm putting an X through your name. Not to say we didn't do subsequent transactions with them, but you got to have people that are willing to write checks right along with you, whether good times or bad times. And the other incubator where we invited, and I can say this because they're no longer involved in healthcare, Kleiner Perkins. The general partner at Kleiner Perkins wouldn't show up for the meetings, and he wouldn't write checks for any of the startups. I mentioned eValve, the interventional cardiology company treating heart valves. They wouldn't participate whatsoever. They lost interest in medical devices, lost interest in healthcare. And then it would, 5 years later, they'd come back to healthcare. But so you got to have venture partners that are totally committed, not just here today, gone tomorrow. So we found, more often than not, the incubators, let's just fund them 100% ourselves. When we went to expansion financing, Series B, Series D, we would bring in other venture investors. But we were driving the transaction. NEA was. And if they weren't willing, in the case of Claire Vista, I think our CEO met with 140 venture capital firms, made 140 presentations, and finally got one small, tiny firm to participate along with us. And as you can see, we sold the company for close to 7 times our capital. But it's odd. Sometimes you hit a point in the market where venture firms are risk averse. They don't want to take on any clinical risk. All they want is, they want all the risk out before they invest. And you go through cycles where you see this. Unfortunately, we've been in I'd say a 15-year cycle in healthcare of devices where people are risk averse.
So we have here at the Stevens young entrepreneurs. They are not starting from an incubator. Sometimes they get the advice why you don't bootstrap the way into it. What would be your advice to this situation, to these entrepreneurs that come from here?
Well, I guess my advice is find successful CEOs, entrepreneurs, or an executive at a large company that's gone through early, building a business. Who can you find to be your mentor? I mean, if I was at a university, that would be one of my first objectives, is what resources can I bring to help me analyze the opportunity, evaluate the opportunity, who in my 50-mile radius, because you can't afford to get on a plane and go track these people down. But I would just work my tail off to find 2 or 3 people that can work with me, advise me, get me ready to do a presentation to a venture firm. And also introduce me to a venture firm. I often said I did one deal at NEA that came over the mail. Every other transaction I ever did at NEA came through someone I knew, a friend of a friend, a network, a corporate entity. I mean, I never did a deal that just, except for once, did a deal that came through the mail. So don't mail plans to venture firms. Find a relationship that knows the venture firm and will introduce you. It takes your credibility up by orders of magnitude.
John, you spoke about one of the companies that specialized in pain management,
Right.
In particular with applications to lower back. And I saw the words spinal cord stimulation.
Stimulation, right.
Can you say a few words about the technology?
Yeah, this company used a certain level of electronic frequency. I think it was 11,000. I'm not a scientist, megahertz. They found a frequency of stimulation that no one had ever deployed in stimulating the spinal cord to eliminate pain, and they patented that technology. Now, Boston Scientific just sued them, claiming they violated certain patents, but their key was no one had ever done extensive clinical trials proving this frequency worked. They spent $100+ million on clinical trials differentiating that this frequency gave you a greater outcome than the frequencies available from St. Jude Medical, Medtronic, and Boston Scientific. So they were able to prove the differentiation of the technology and went in 5 years, from 0 to 400 billion in revenue. So the marketplace recognizes that this technology is truly differentiated. So it was just sort of a quirk of technology, finding the right frequency.
Well, John, thank you very, very much.
Thanks.
It was really impressive. Thank you very much for coming. This is a plaque to express our appreciation.
Thanks, Tom. Thank you. Thanks, Tom. Thanks so much. Thank you.